Welcome to my YouTube channel Open Minded Medicos. This is the second video on our channel. Let's start with the revision of the first video. In the first video we see the something important points like surface landmarks of the thorax and its important skeleton of the thorax. Thorax is the mainly trunk. First the trunk is mainly divided into thorax and the abdomen. Thorax is the upper part and the abdomen is the lower part. Let's see in the first video. And then the surface landmark, there is a main 2 points, suprasternal or jugular notch and the sternal angle or the angle of Lewis. Suprasternal is the between the sternal angle of the clavicle and the sternal angle at the lower border of the T4 or T5 vertebra. Sternal angle it at the mandibulosternal joint. Mandibulosternal joint is the type of the secondary cartilaginous joint and xiphisternal joint is the type of the primary cartilaginous joint that we see in the first video. Then the skeleton of the thorax. First, there are the 12 pair of ribs that we see in the first video. First and the seventh ribs are called as true or vertebrosternal ribs because they are attached to the vertebral and sternal both sides. 8, 9, 10th ribs are vertebrocondylar ribs because they are attached to the vertebra and on the above side, anteriorly side, they are attached with the cartilaginous of the 7th rib, and 11 and 12th pair are floating ribs or vertebral ribs and they are also called as the false rib. Let's start with the topic of the second video. In the second video, we discussed the shape of the thorax, inlet of the thorax and outlet of the thorax and structure passing through the diaphragm. Let's start with the shape of thorax. First, start with the shape of the thorax. The shape of the trunk is truncated cone, means the above part is the narrow and the below part is the broad. This is shown in the diagram. This is the neck region, this is thorax and this abdomen. The trunk is divided by the diaphragm that we see in the first video. The neck and the thorax is divided by the Sebum's fascia. There is the suprapleural membrane. Sebum's fascia is the flattened tendon of the scalenus minimus muscle. The thorax is mainly oval shaped and abdomen we discuss in the later one. The diaphragm is the deep convex towards the downward side. The transverse section of the thorax is the reniform shape or kidney shape. This is remember transverse section of the thorax is kidney shape and normally it is the oval shape. In infant, the ribs are horizontal so that its respiration is the purely abdominal. In adult, the ribs are oblique and the thorax are oval in shape. So, in adult, the respiratory system is thoracic and abdominal respiration that are both occur. Superior aperture of inlet of thorax. Inlet of thorax means the upper part of the thorax, neck and thorax. This is the inlet of the thorax, upper part of the thorax. The upper part of the thorax is the kidney shape. Please remember this diameter's value. Transverse diameter is the 10 to 12.5 centimeter and anterior posterior diameter is the 5 centimeter. So the transverse diameter is very much large than anterior posterior diameter. Let's see the boundary of inlet of the thorax. This is the simple diagram. This is the mandibulium of the sternum. This is posterior side. There is the rib, anterior rib, vertebral column, etc. Anterior side, it is the joint upper border of the mandibulium sterni, upper border of mandibulium sterni. Posteriorly, superior surface of the T1 and the side there is the first rib. Anterior part is, this is 90. Anterior part is 3.7 centimeter below the posterior part. Means the posterior part is the above the anterior part 3.7 centimeter. The structure passing through the inlet of the thorax, there are many types: viscera, vessels, small vessels. Viscera में trachea, esophagus and the apicals of the lung. Vessels में right bronchocephalic artery, left common carotid artery, left subclavian artery, right and left brachiocephalic vein are passing through the inlet of the thorax. Small vessels like internal thoracic artery, superior intercostal artery, first posterior intercostal vein and internal thyroid vein. Then the nerve passing through the inlet of the thorax is phrenic nerve, vagus nerve, sympathetic trunk and the first thoracic nerve. First thoracic nerve join the brachial plexus by passing through it. The muscle, the three muscles, they are originate from the inlet of the thorax is the sternohyoid, sternothyroid and the longus colli muscle. Let's see inlet upper part, outlet the down part. Outlet of the thorax anteriorly is covered by infrasternal angle, posteriorly body of the T12 vertebra and on the side cartilaginous of the 7 to 12 ribs. Let's see that structure passing through the diaphragm. Structure passing through diaphragm. Pass through diaphragm. थोरेक्स और एब्डोमिन के बीच में डायफ्राम होता है, उससे कुछ स्ट्रक्चर पास होते हैं जो थोरेक्स में से एब्डोमिन में जाते हैं. देयर आर 3 लार्ज ओपनिंग एंड देयर आर समथिंग सेवरल ओपनिंग. लार्ज ओपनिंग में मेन 3 वेना केवा, इसोफेगल एरोटिक्स. लेट्स रिमेंबर विथ VOA. Vena cava opening at T8, esophageal at T10, and aortic at the T12 level. But between xiphoid process and the 7th costal cartilage, there is the space of Laracy from which superior epigastric artery is passed through this. And at the 9th costal cartilage, musculopharyngeal artery is passing through it. This is the introduction of the thorax video. If you like this video, please like, share and subscribe our channel. Thank you for watching this video.